Namaskar dosto. Welcome to channel Toxicology on Board. Today in this video we'll be discussing about the DABT topic embryo-fetal developmental toxicity under ICH S5 guideline. Probably this will be my either second or third video on ICH S5 guideline. So please after watching this video you can also go back and see in my channel other questions which are uploaded with respect to ICH S5 guideline. Let's directly dive into the question. The question is what actions must be included when assessing embryo-fetal developmental toxicity under ICH S5 guideline. Okay, let's understand. Let's look into what are the options. Okay, we have option A: examination of weaning for gross and visceral abnormalities. Option B: treatment of male and female rodents for 60 days to assure implantation. Assessment of resorptions, fetal body weights and fetal malformations. Assessment of neurobehavioral deficits incurred during prenatal exposure. The right answer will be in option in text green. Option C, assessment of resorptions, fetal body weights and fetal malformations. So these are the actions must be included when assessing embryo-fetal developmental toxicity under ICH S5 guideline. Okay, examination of weaning for gross and visceral abnormalities. Probably this might be there in prenatal and postnatal studies. Treatment of male and female rodents for 60 days to assure implantation. I think this is in segment 1 study, that is fertility early embryonic developmental study, and assessment of neurobehavioral deficits incurred during prenatal exposure. Again, this particular and you have to observation you have to see in prenatal and postnatal studies, PP&D study, that is nothing but segment 3 study. Let's see what is the explanation and the reference which is given by American Board of Toxicology. Okay, so these are needed to determine extent of unsuccessful implantations, predictive in fetal toxicity, and diagnostic for teratogens. So these resorptions, fetal body weights, and fetal malformations, why do we need? We are needed to determine extent of unsuccessful implantations, that is resorptions. Fetal body weight, predictive in fetal toxicity. If the body weight of the fetus is decreasing, you can understand that it leads to fetal toxicity. And diagnostic for teratogens. If there are any fetal malformations, whether visual malformations or skeletal malformations, then you can understand these are for fetal malformations. So as I said in my previous videos also, please read in detail ICH S5R3 guideline. Okay, Annexure 1, this particular is given in vivo study design. Section 1.1.2.3, table 3 is given. Please read in detail. Okay, so let's see some of the important tables from the guideline as well as from the Clayson textbook. Okay, this reference is taken from Annexure 1. Okay, this is directly taken from the table 3 what they have given in ICH S5. So what is this table 3? Table 3 is about embryo fetal developmental toxicity study design for rodent, rabbit as well as NHP, that is non-human primate, that is monkey, right? So our question was with respect to fetal malformations and resorptions na. uh, so that observation, see, first you see parameter. We have under parameter we have GLP status. By GLP status means there will be some preliminary studies will be there and some will be main study. So this is in case of preliminary embryo fetal developmental study, the study is optional. You can do either in GLP study or non GLP study, but the main study you have to do in GLP only, either it is in rat, rabbit or non-human primate. Okay, under parameter only you will be having minimum number of pregnant females you have to count after exposing to the chemical and mating with the male. How many females are pregnant? Number of dose group, low dose, mid dose, high dose, administration period during the gestation also, GD 6 to 17, 6 to 18. This is again very very important. In the rat it is 6 to 17 or 7 to 17 or certain times 6 to 15 or 7 to 15. Okay, mice के लिए this is 6 to 15 or 7 to 15, whereas in the case of rat it is 6 to 17 or 7 to 17. In the case of rabbit, the gestation period is GD, gestation day, 6 to 19 or 7 to 19. Certain times it is also given 6 to 18 in some of the studies. In the case of non-human primate, the gestation is approximately GD 20 to at least GD 50, right? In the case of antenatal endpoints, you have to see clinical observations and mortality at least once daily, same in all species. Body weight, food consumption at least twice, at least once weekly, and TK. TK is optional in the case of preliminary studies, non-GLP studies, but it is important in the case of main study. And coming to postmortem endpoints, we have cesarean section, which will be done on gestation day 20 in the case of rats, or 21, or in the case of mice, it is gestation day 17 or 18. In the case of rabbit, it is the cesarean section is performed on gestation day 28 or 29. In the case of primates, it is done non-human primates. It is just a cesarean section is performed on gestation day 100, right? Then we have macroscopic examinations, which will be done except optional in the case of non-human primates. Gravid uterine weight, right? Then you have corpora lutea, implantation sites. So live and dead conceptions, early and late resorptions, inner option, resorption was there, gross evaluation of placenta, fetal weight was also there. Remember body weight, fetal weight, then weight of the placenta, fetal body weight, fetal sex, and fetal external evaluation. So if you know this table, the three options were here only: early and late resorptions, fetal body weight, and fetal external evaluation. So in our option, this was there. So if you read ICHS-5 guideline, these are from, if you remember this table, you could have answered that question, right? Now let's directly go to next slide. We have reproductive general. The placenta is hemochorial in human, 3 layers, but is hemoendothelial in rats and rabbits, 1 layer. Barrier for compounds of less than 1000 Daltons. Uteri in rats is bicornuate and estrus last 4 to 5 days. Dominant lethal test involves treating a male with single dose and mating weekly with 2 female for 8 weeks. The females are sacrificed and number of live embryos is determined. The dominant lethal test is sensitive to all stages of spermatogenesis. The sperm cycle lasts for 9 days in mice and 16 days in the case of humans. Sensitivity to toxicants is in the order germ cells, Sertoli cells, and Leydig cells. So, certain chemical, if it is exposed, first it will affect germ cells, then next Sertoli cells, then it will affect the Leydig cells based on the sensitivity. One spermatogenic cycle is 5 weeks in the case of rats. Gestation period in mice is 19 days, rats 21 days, rabbit 30 days. Remember the table, right? So, probably the previous slide, no, it will be difficult for you to remember. Pause the video. That table, that important points were taken from Clayson's CD summary. Cassette and only summary book will be there, which will be around 600 to 700 pages book. From that, I have taken, from that notes I have taken. And coming to this table is given in Casseret and Dole 9th edition, chapter number 10, Developmental Toxicology, page number 554. You can directly remember this table. In this table, it will be given about organogenesis, as well as it will be given about length of the gestation, right? So you remember across what species, right? I have discussed in my previous videos also about this table. Okay, then next, from the Clayson CD summary only, I have let's discuss some more important points. The critical period for rat teratogenesis is during organogenesis from 6 to 15. So rat may organogenesis period 6 to 15, you have to remember. And the following organs are most susceptible. What are those organs? Eye 8 to 11 days, brain 9 to 12 days, heart and axial skeleton 9 to 12 days, aortic arches 9 to 15 days, palate, this palate is there, no, hard palate and cleft palate is very important, 12 to 15 days, urogenital 14 to 17 days. Variations: slow cartilage formation, wavy ribs in rats, delayed ossification, right? Malformations examples are cleft palate, missing rib, syndactyl means their digits will be there. No, there will be some malformation, some kind of abnormality will be in the digits formation. Incomplete neural canal closure, very very important. If your channel closure is not happening, then there will be there is a there is a abnormality in that particular child. Teratology studies in rodents. Highest dose should be slightly fetotoxic. So whenever you are doing this EFT studies, you have to select a dose in a way that one of this highest dose should be slightly, it should cause damage to fetotoxic but not metanotoxic. Mother may it should not toxic, but it should cause. So you go and try to pause the video and try to read. So you will come across this word with maternal toxicity, without maternal toxicity, fetal toxicity with maternal toxicity, teratogenicity without maternal toxicity with maternal toxicity. Very very important. For example, best example is thalidomide, which was teratogenic in the, but it was without maternal toxicity. The chemical was exposed to the female mothers, but mothers did not show any toxicity, but after the babies were born, they were malformed out. It's a classic example for teratogenicity without maternal toxicity. If there is a toxicity to a chemical to the pregnant mother, and the mother shows some toxicity, it is already assumed that yes, the children, the baby or fetal and embryo will also show toxicity. But it is more dangerous when the mother appears to be normal, but eventually it will cause damage to fetal or embryo. Okay, then this is again very very important. I have listed out some of the, this is also taken from class and CD summary only, casted dull summary. Very quickly I will run through, so you can pause the video and you can open your chat, your Google, in that you can, or your any textbook, and you can read in detail. So the following compounds have been shown to have reproductive and developmental effects. So try to read. These are the list of chemicals which have caused reproductive toxicity and developmental toxicity. Ethylene oxide, very very important, because of its epoxide structure, no, highly reactive. This chemical coming in contact with any biological membrane, it will cause cell membrane, it will cause toxicity. It will cause reproductive or developmental toxicity because of the high formation of radical formation takes place. Anesthetic gas, isoflurane, anesthetic gases will be there. No, those examples are there which are causing reproductive and developmental toxicity. Then methyl mercury. Separate video on methyl mercury I have given. Mercury two forms. Always remember inorganic, organic. Organic may you have methyl mercury CH3Hg. How this methyl mercury is causing bioamplification, mini matter disease, how it is caused teratogenicity, very in detail you can learn. I have a separate video on methyl mercury on in my channel, you can read. Lead, out of the metals, one question you might get like this: which of the following metal causes reproductive development or toxicity? In that one option you might have lead. Other metals might also be there which are causing. So read those metals. We have in the periodic table 100 plus elements, metals are there. Try to categorize what are the metals and what is the type of toxic, because you have in the Clayson separate chapter on metal toxicity also. Okay, you have separate ICH Q3D guideline only on metal impurities. So lead is very frequently found. How the lead is causing toxicity, how it is affecting the development of the child brain. So that also you see. Then diethyl stilbestrol, which is in the case of female. DES is also very important. It's a classic example. Apart from thalidomide, another example which is causing I think it is causing vaginal cancer, I guess cervical cancer, where the pregnant mother is exposed during her pregnancy. She will be taking some kind of pills, morning pills or something like that. uh, but the babies which are born after several years, when they reach their teenage, at that time they are subjected to cause either cervical cancer or vaginal cancer. This is again very classic example, diethyl silvestrol. Then we have PCBs. In that example is chlordecan is there. Then we have DDT. DDT separate video I have uploaded. So how DDT is causing embryo fetal toxicity. Then under solvents we have carbon disulfide, ethylene dibromide, ethylene glycol, Okay, again glycol, ethylene glycol will be there, methylene glycol is there, DGME is there, ethylene glycol, monomethyl ether, diethylene glycol, dimethyl ether. Like that class of glycols are there, which are example. And you, with this you can also read about sulfonylurea elixir, in which polyethylene glycol, how it has caused the toxicity. So all you try to relate, integrate and read. Okay, read in detail about glycols. So how the glycols, one option on glycol toxicity we will be getting ethylene oxide. Okay, then you have because of again epoxide ring structure, it will be C2H5O. Then you have vinyl chloride, again it is a part of plastic. Ethanol, again I have separate video on solvents, ethanol, methanol, isopropyl alcohol, how they are causing the mechanism or the formation of this their metabolite, how it is causing toxicity. Then you have benzene, six member drinker, highly reactive. Then toluene, styrene. So these are the best examples for solvents. Read ISET Q3C in detail also, and all the solvents read in detail. Have some awareness. Carbon disulfide, what it is causing. Ethylene dibromide, what it is causing. Then we have tobacco, aniline, veratrum alkaloids, that is teratogens. You have mycotoxin, zeralolinol, which is the component in the this fungal toxin. Thus you kill again. This is a classic example. Read about the corn, how this corn which are affected with this fungus, how it is causing this formation of this mycotoxin, how it is causing developmental toxicity. Then you have cyclophosphamide, anti-cancer drug, right? The, then we are coming back to last slide. The testes are affected by dibromochloroPropane and monoethyl hexyl phthalate, Sertoli cells. So this is the one which is affecting Sertoli cells, and dibromochloroPropane, it is affecting. Okay, they are affecting the testis. Dinitrobenzene, N-hexane, acrylamide, TOCP also contaminant in the case of ginger jake paralysis. One particular point I done one in one of my video in my channel. Go in detail and read. Cephalosporin, antibiotics, then hexachlorophene, solvents like glycol ether, like 2 ethoxy ethanol, methoxy acetic acid, methyl pyrrozole. Very important again. Okay, and ethylene dibromide, which are affecting, which are causing damage to the to the testis. Agents and their effects include, if you look at phenytoin, which is an anti-epileptic drug, it is causing digital hypoplasia. Vitamin A, so which of the following vitamin causes malformation of the eye, palate or genitourinary tract? Option will be vitamin A, the right answer will be. Ethanol, mental retardation, facial malformations. In the case of babies, you will feel similar to mouse, narrow forehead, short palpebral features, small nose, mid face, and longer upper lips. So remember this this now fetal alcohol syndrome in the case of babies, how it is forming. One video again I have already uploaded in my channel, you can read in detail. Thalidomide, which we discussed, of phocomelia, smaller limbs, 6 to 7 weeks in critical period in humans. Rodents are insensitive, that is the reason we couldn't detect this thalidomide in before this particular incident. Earlier EFD studies were done only in one species, that is in rat. After this, they have implemented in the guideline that they have to do in two species, that is rat and rabbit. If you see fertility studies and prenatal PPND studies, prenatal and postnatal studies, that we will be doing only in the rats. But EFD study is the one which we'll be doing in rat as well as in the case of rabbit, right? Then diethylstilbestrol, vaginal adenocarcinoma, cornification of vaginal epithelium in rats. Diethylstilbestrol is used as a morning after pill and for food supplement for cattle. Okay, two applications for this drug. Then we have so misuse of this drug was done in the cattle. There are a lot of historical evidences or incidents are available. Go and check in detail. You can read how this drug is misused in the case of cows, how they are giving, to as a food supplement to get more milk. So lot of incidents are there. You can go back and read or watch some videos on this particular topic. Cyclophosphamide, drop in spermatogenesis. So this particular drug is used to develop a male fertility model in the case of animals. Ethylene dibromide, drop in spermatogenesis decrease, motility, so sperm motility will also decrease, abnormalities in the bull. So again, two examples, see how these chemicals know how they are misused in the case of cattle as well as in the case of veterinary animals and bulls that you can see. Then that's the thing. In this video is a bit length, so we have come across in this video two to three tables we have come across, and we have listed of examples how they are affecting fertility or testis damage, or I've listed of the certain solvents also. So pause the video, go back and read in detail each and every chemical, what is the classic examples, and the nature of that particular chemical, how they are causing the toxicity. I again keep saying, read ICHS5 guideline in detail. Okay, for any questions, be curious. For any questions, you can write down a mail to so and so arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board. All the best for your exam. Thank you.